Now, of course, we know there's been plenty of attention in Australia about the potential spread of Ebola from Africa, but the recent death of a woman in Far North Queensland has now renewed fears about the importation of another potentially deadly disease from Papua New Guinea. The 32-year-old Torres Strait Island woman died in Cairns in September from a strain of drug-resistant tuberculosis common in PNG. Health authorities say it's inevitable more cases will cross the border, but it is not a cause for panic. Here's Pacific Affairs reporter Liam Fox.
The village of Porabata outside Port Moresby sums up the TB situation in PNG. Crowded living conditions, poor sanitation and limited access to treatment makes it an incubator for the disease. A resident here was one of the first two people in the National Capital District to be diagnosed with the most serious, almost incurable form of the disease, extremely drug-resistant tuberculosis, XDR-TB. And there have been other cases of the less serious but still deadly multi-drug resistant form, MDR-TB.
There was a patient here, but she died of MDR.
When the ABC visited Porabata, the local health clinic was closed. Instead, health workers were trying to raise awareness of the disease and how it spread.
I would say that one of the major causes is that we have people living in extended family in the house. And a person who is infected can likely pass that sickness to another person.
A quarter of all of PNG's TB cases are in Port Moresby and its surrounds. At the country's biggest hospital, doctors are struggling to deal with the crisis.
In the hospital, we have about 4 medical wards, and 2 of those 4 medical wards are occupied by TB. So it's quite alarming when we are looking at the number of TB cases that are coming into the hospital.
A quarter of all admissions are TB related, and many of those are for drug-resistant tuberculosis.
One main reason is that patients have given up on treatment. They have not been faithful, they have not been consistent, and now coming back with TB again.
The death of a woman in Cairns in Far North Queensland from drug-resistant TB in September has renewed fears about the potential for the disease to spread from PNG to Australia. The 32-year-old Torres Strait Islands woman was a frequent traveller to PNG, and her own mother died from the disease last year.
We've got the DNA analysis, the genome of the first case fully analysed, and it's the same strain that we commonly see in the western province of PNG.
It's only a short boat ride from PNG's western province to the islands of the Torres Strait. There are daily flights from Port Moresby to Cairns, and the city is home to Australia's largest population of expatriate Papua New Guineans.
With that degree of interaction of the populations, there's bound to be spread of infection. But it's not going to happen quickly. TB spreads very slowly. There's no need to sort of panic about it. It's not Ebola. It's nothing like it.
This is something that I have been warning now for the last 4 years. And unfortunately, up until now, has been falling on deaf ears.
Despite the threat of drug-resistant TB, the federal member for Far North Queensland doesn't believe tighter travel restrictions are required.
I think the worst thing that we could do is sort of pull the shutters down and say anybody that can't come from here and there's a risk of tuberculosis. I mean, you know, we need to be offering that support for people that need it.
Mr Ench is championing a $2 million project to improve medical services in PNG's western province so people don't have to travel to Australia for treatment. Liam Fox, ABC News.